I'm Dr. Jolie Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experiences with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient, 71-year-old male. He is diagnosed with diabetes for the last 20 years, hypertension for the last 15 years, and now the problem is he has, as a routine checkup, he has gone for an ultrasound scan and it showed that chronic liver disease is there, fatty liver grade 3, and the fibro scan shows the grade 4 stage. And also there is he's not alcoholic, he's having a non-alcoholic steatohepatitis and the liver enzymes is high. And his kidney function also, there is a stage 2 renal failure also is there. And prostatic hyperplasia, grade 1 prostatic hyperplasia, and skin itching all over the body and varicose veins. So multiple problems are there. Here I will try to explain how the surgery could be avoided, how long it took for multiple medicines to be reduced or stopped, how long it took to get relief from symptoms, and progress evaluation based on corresponding improvements in periodic tests. When we come to the patient details, this is a 71-year-old male. His height is 168 centimeters and weight is 64 kg. And her abdominal obesity is there. The abdominal circumference is 89 centimeters and there is excess fat in the body. It is around 36.1 is the fat percentage. And ideally, a male should be having around 15, at this age around 15 percentage of fat. She is having 36.1. And he was diagnosed with the diabetes mellitus for the 20 years, type 2 diabetes, and he is on medication. And hypertension 15 years. And chronic liver disease and NASH and fatty liver grade 3 and fibrosis, liver fibrosis stage 4. So 1 week it is diagnosed. Before that he was not knowing about it. And also when we are looking into his detailed investigation, he is having GFR is down and he is complaining of frothy urine also. And now stage 2 renal failure also is there. And benign prostatic hyperplasia, that is grade 1. And he is having skin problems like itching and also varicose veins on the leg. And when we can come to the category of the disease, which is metabolic syndrome is there, and also autoimmune disease, and also degenerative changes because of the old age is there. When we come to the symptoms, he's not having much of the symptoms actually. It was never having. Only symptom he's noticed is frothy urine. Some urine from this bubbles are when we are passing into the closet. And also sleeping difficulty and some itching in the skin. So he was not, that is the problem with the liver. Actually only at the end stage you will become symptomatic. So you had to do the investigations and find out if these all things can, you need not wait for the stage 3, 4 level. Actually it must have started many years or 20 or 30 years ago itself as a fatty liver and even the liver enzyme changes. And when we come to the medications, as he is taking 2 medicines for the hypertension, telmisartan 40 mg and amlodipine 5 mg. And for the diabetes, he is taking glycinase MF, that is glycinase and metformin, that is glycinase 5 mg twice, both is taking 2 times. And when we come into the details of his blood test, and his diabetes is fairly controlled, HbA1c is only 5.8 and sugar is normally 83, but insulin level is high. That is hyperinsulinemia is there and ESR is high, inflammatory marker, ESR high, SGOT, SGPT is high, that are liver markers. and other liver function test is okay, and the GFR is 75. This kidney function is down, and microalbuminuria is there. That is not, microalbumin is not too high actually, it's only 70, around 69.22, and vitamin D is very low, that is 8.8 only. And the toxic element, we look into any other toxins inside the body, especially the heavy metals, is positive for tin. Actually, tin is almost 13.7. It should be less than 2. Next, when the abdominal scan, there is diffuse cross structure of the liver, and CLD, that is the diagnosis, and prostate BPH is there. And elastography shows stage 4 fibrosis. And when we come into the body details, and he's 64 kg, and his fat percentage is high. That was and the abdominal obesity was the major problems when we look into the body details. And even his BMI is 24.4. That is okay. Like ideally, Indians it should be less than 23. He is not obesity or obese patient. He is slightly overweight, and some abdominal fat is there. That is, he's not that obese. That is why his diabetes is controlled with these medicines. Go into the details of the clinically supported lifestyle correction, and then this sort of patients we will look into what is the reason. There are many patients who is having much more diabetes and much more hypertension. They are not going into the fatty liver. Even he's not an alcoholic, and also he's not a severely obese or anything. Even though he is getting this fibrosis, what is the reason? So definitely there will be a connection with the food. Any disease, there will be a connection with the food. Why? Our body is made of food. So there is always connection with the food if you are sick. So this patient, when we look into his, he's having some itching on also. So his IgE level was very high. And so many items he was allergic. And even the house dust mite, and some food like a tamarind and a rice. He's allergic to rice. That is a staple diet in our part of in Kerala. I'm practicing in, he's a Malayali. I'm practicing in Kerala. So our main food is actually rice. He's allergic to that also. So we should remember that his body is reacting to rice. It is a staple food. And papaya, one of the very common vegetable. Most of in the countryside, everyone will be having 1 or 2 papaya plant. So they will be taking papaya also as a regular food. And the peanuts allergy. So many items actually. Oats, pistachio, almost all the nuts also are allergic. And milk, egg, wheat, he's allergic to wheat also. So many items actually he's allergic. So what in clinically supported lifestyle correction, what we do is, we'll ensure all the nutrient by giving support food, and with the minimum type of ingredient, because too many ingredients, chance of getting irritability, and the immune system will be finding it difficult to handle too many items. There is an autoimmune factor also there in this patient. So otherwise he will not be having this much of problems, even with a healthy diet. Supposedly, because a patient who is having diabetes and control of HbA1c is 5.8 means that he's fairly looking his diet pattern and all. He's very conscious about his diet and all. Along with the food, actually what we are giving is like moderate exercise also. That is in the sitting and lying down position. He's 71 years. He cannot do heavy exercises. So, but we have to burn out this excess fat, especially in his tummy. So then what is the result actually? Symptomatically, he is this frothy urine, decreased sleep and itching was the problem. And by the 8th day itself, his symptoms is reduced. Almost 90% is symptom free. And by the 15th day, he's totally symptom free. And when we come to the medication, and within the first week itself, when the diabetic medicines we stop from the first day itself. And when he comes to 8th day, he's taking only he was on 2 diabetic medicine and 2 antihypertensive. 2 diabetic medicines is stopped in the first day itself, and he is taking only one of the tablets. So tell me, Sartan, we are taking half tablet. when on the 8th day, the amlodipine was stopped. And when we come to the by the 15th day, he is not taking on any medicine. He is medicine free from the 15th day. When we come to the blood reports, and with his fairly very good control of diabetes, his HbA1c was 5.8 with the 2 tablets. 2 tablets, not 4 tablets, actually 2 type of medicine, morning and evening. And without medicine itself, his HbA1c came down to 5.7 without medicine on 8th day, and by 15th day it was 5.6, and 30th day 5.5. He was maintaining it throughout till 120, 5.3, 5.5. So he is non-diabetic by the 15th day itself without medicine, and he is taking for a long, so many years he was on as a diabetic medicine. And maybe one of the reason for this liver problem, maybe his medication with the diabetes and for the hypertension is taking for more than 15 years or 20 years or something like that. So any medicine which is we are taking is coming into the liver first, and it is liver's problem duty to detoxify or metabolize it and make it. It is not a nutrient. Liver is supposed to make use of the nutrient for making body building materials, and anything other than a nutrient, liver has to destroy it. And only those things which is escaping the liver system and coming into the main circulation is acting as a medicine. So whatever medicine you take, it is harming the liver. And in fact, the most impact is coming on the liver. And if you are having a liver problem, if you are on medicine, you are actually increasing the workload. If you are sick, you want to rest. If you are having fever or if you are sick, what we want to rest and sit lying down for some time. But when we are the liver is saying that I am sick, you are putting more work into the system for the liver by adding medication. So that we should be very concerned of our organs also. They also need rest. That's the primary thing everyone should understand. Next, other things actually, his insulin was very high. That is high insulin resistance. That is the reason for this type 2 diabetes. And his insulin come down to 2.6 actually. We checked it on the 60th day. It is normal. And ESR was high. That also gradually came down. When we come to the liver function, actually SGPT and SGOT is high. There is evidence of hepatitis. And it is came down by the 8th day, again it came down on the 15th day, and again drastically reduced by the 30 days, and by 60th day it's the normal. And it was maintaining in the 90th day, and also 120 days it was maintaining. The hepatitis part is inflammation in the liver is reduced. That shows the liver enzymes come down. That means that the hepatitis or the inflammation in the liver is reduced. Then about the GFR, he is having his initial GFR was 75, and it was maintaining it is 75 in the 15th day, but it is increased to 80 by the 30th day, and it is maintaining like that. By the 90th day it is increased to 84. So he's a 71-year-old man. Our intention is to not to make it down, at least keep it in the second phase itself. But 75 to it was by 90 days it was increased to 84. That's a good result for this age actually. And microalbuminuria, that was one of his complaints, and it is reduced in the first week itself, and again reduced by the 15th day, and came down to normal by the 60th day. It also took some time. Some patients it is even the 7th day itself. Some patients 7th or 15th day will be corrected, but there was not much albumin in the urine, but it took some time to correct it. By 60th day it was maintained. Okay. And vitamin D was very low. It was got corrected by 30th day. And tin, that is a toxic element, was there. That also, because we are trying to remove the toxins from the body also by improving circulation. By the special type of exercise, usually the toxin also will be got out. And by the 90th day, that usually we check the toxic element only by after 3 months. By 3 months, it is tin also is reduced. It was normal. Next, what was the result? Usually we recheck the scanning, ultrasound scan also, usually by the 90th day. for this is liver problem. So 98th, but for the cancer and all, we check every month or even every week if you want to see whether it is increasing in size or decreasing. It may not go, but for the cancer and all, it may not go, but if 1 month itself the size is reducing, it is so much reassuring for the patient and also definitely the doctor. By 90th day, actually his fatty infiltration was reduced, and also the prostate size reduced. BPH was there, but the BPH part is reducing, and also fatty infiltration was reducing. But it will take, the fibrosis will not go off like that. But we have the blood parameters are getting corrected, but it will take some time for the, we can remove the fibrous tissue, but we can develop with the nutrient and repair the cells. What we have to be expecting for this patient is this hepatocytes should increase in numbers and thereby repairing the liver. So that is actually, liver has a capacity to regrow. That is, the hepatocytes has the capacity to multiply and produce new cells. Once this inflammation, this destruction process is stopped, this new cells can develop, and gradually it will more and more healthy cells, hepatocytes will come up, and then liver will be liver size also will start increasing in size. So that we have to wait for some more time. So the hepatocytes lifespan is almost in 1.5 years. So it has to regrow gradually. For that, we should give ensure that all the nutrition is there to produce new cells. Nutrition must be there, and also you should avoid the toxins. So we should avoid all the food which is reacting to your body, and also avoid all the preservatives, chemicals, coloring agents, tastemakers, all these food additives, which is of now nutritional important. That is the most important part of this type of patients. So if you are able to do that, at least this patient may need some more time for follow-up also to regrowth of the liver. We are giving a part of the liver for liver donation. Live liver donation is taking place. No? So for the dearest one, a part of the liver is donated. So in that, even the around 60 to 70% of the donor's liver is removed and given for the recipient actually. But the donor liver can, if the correct nutrition and everything support is given, donor liver will be regrown within 2-3 months. So that is the capacity of, if the healthy liver can regrow. So that we can use it here also. We are not, liver patient cannot donate, but you can regrow the liver. That is the importance of liver actually. So that is a positive of the liver. You can multiply, the hepatocytes can multiply and regrow, and you can improve your health. Next is, what are the changes which has happened in this patient during this time? Actually, in the clinically supported lifestyle correction, what are we trying to do is to correct the body itself, body composition. By correcting the body composition and correcting the body composition cellular level, and correcting the immune system and the neuronal and hormonal system. For this patient, actually, he was initially he was 64 kg, and in the 8th day he's come down to 61.7. See, the symptoms also has gone by the time, and definitely he's taking correct nutrition for minimum number of ingredients. And 15th day 60.9, and 30th day 58.3, and 60th day it is 54.4, and by 90 days 53.3. So, and his BMI was initially 24.4. It is slightly higher for an Indian. And what we are trying to do is actually to lower normal. For the Indians, ideal is 18 to 23 is the normal. For the Westerners and all, we generally take it Caucasians, and 18.5 to 25. For Indians, it is always ideal is 18 to 23. If you are getting older, and also when you are less and less active, always bring down your BMI to low normal. For this patient, actually by the 90 days he's come down to 20.3. Ideal is 15%. Fat should be 15%. Okay. Then when you come to BP, he was taking 2 tablets for the BP. Two type of medicine for the BP, and with that also his BP was 140/90. But after reducing, in the 8th day itself, he is reduced to half the tablet, and with the reduced this thing, his BP was 130/70, and without medicine again 130/70 in the 15th day, and by 30th day without medicine it's come down to 125/80, and by 60 days it is 110/80, and it is maintaining in the 90th day also. So that is the importance. Even with the medicine, his BP was slightly higher level, but after stopping all the medicine, it just came down perfectly normal. And his abdominal circumference, that is the problem when the old age comes, or when you are getting older and older, the fat is accumulated, and that will be a major part will be in the tummy, because it is easy to dilatation. So tummy fat is the problem, and his abdominal circumference are 89 centimeters and came down to 82 within 30 days, and by 60 days it's 78, and 90 days it is 76. So that you should see the change in the body is also equally important in clinically supported lifestyle correction. And even he's 71, but initially itself his age was 66 only. So body age, because he's keeping trim and healthy, so his body age is not that high. But by 30 days, his body age come down to 59. So almost 7 years younger. And by 60 days, this is 56. And by 90 days, his body age is only 53. Now he's very healthy, young. Only organ which is mainly affected is liver. So if you regrow the liver also, he can lead a very young. Comparatively from 71-year-old man, he is getting the youthfulness of a 53-year-old man. And the fat percentage change also you should notice. And fat percentage was initially 36.1. It just came down to 31.5 by 30 days, and 29.6 by 60 days, and 29 by 90 days. But what we want is to bring down it below 20% at least. Ideally 15%. At this age it may not be that easy to say. It is when the old age, it is very difficult to build up muscle. It is easy to if you control food and do some exercise, we can reduce the fat, but it is not that easy to build up muscle and bone. But if it is a 41 year or around 30 years, it is easy to build up muscle also. So what we are try to build up the muscle and also reduce the fat, and we will be trying to reduce the BMI to around 18 to 19, and gradually building up, and we will maybe at least we will be able to bring down fat percentage around 20. That is what we are, for this age we are expecting that also, at least to below 25. That itself will do for him. Next, what are the benefits for this patient who has undergoing this clinically supported lifestyle correction? See, there is no treatment for fatty liver or the liver fibrosis or cirrhosis in modern medicine. Maybe some, if it is in the early stage, there may be something I don't know about the Homeo and Ayurveda. Generally, any medicine if you are taking, it is toxic to liver. That is the primary, we should understand that. And this patient also, there is nothing can be done. Only the doctors will say that you control your diabetes, that's all. So otherwise there is no treatment. For such a patient, in the clinically supported lifestyle correction, what we give importance to is to avoid the toxins. All the medicines is our toxins. Body doesn't need all the medicines the body considers as toxin. So we want to first stop the medicines to protect the liver or the kidney. He is affected by the kidney, also affected CKD and CLD, both is there, and diabetic and hypertensive. So first we had to come out of the diabetic and hypertensive medicines which he is taking. So that we are able to do in 15 days itself. That is the advantage. Now his diabetes, he doesn't have diabetes, he doesn't have hypertension. He's not more a patient for the diabetes or hypertension. Actually, he was taking diabetic and hypertension last 20 years. He was taking diabetic medicine and 15 years for the hypertensive medicine. And most probably that is one of the reason for his liver problem also. Because any medicine can, the only thing, some medicines fast liver failure can occur. Some antibiotics or the chemotherapy agents, you can the liver can fulminant liver failure can occur within a month or so, or even 15 days. It can happen, but this is a gradual destruction of the liver cells. That is why this is chronic liver disease, CLD. So it's all the cirrhosis and all happening in chronic liver disease. So first thing we give importance is to come out of diabetes and hypertension. In my experience, type 2 diabetes is easy to treat and 100% result, provided the patient is willing for following the regime. Kidney patients with stage 5 renal failure and all, it is difficult, but it is possible to stop all the medicine. Kidney patients also, it needs to be, coming out of medication is the most important then, because it is actually increasing the workload of the kidney. Already kidney is in failure, so even in the liver failure or in the kidney failure, what we are giving importance to come out of medication. So in most of the medicines, we will be able to come out of within a month. Then too much of medicines those are using also. Even the psychiatric medicines, many may be taking psychiatric medicine. But if the patient is fully following, we will be able to come out of most of the medication, cardiac medication, and everything within in a month, most probably. But the exception is this blood thinness. Blood thinness, if they are put on any pacemaker or this valve replacement, such patients, we cannot come out of this blood thinness, because there is a chance for, if they don't take that blood thinness anti-clotting medication, they will get a clot and can get a heart attack or a stroke. But if they are put a stent in the heart, they may need 1 year. After that, that also can be reduced. That is our experience. And within if the stent is put, all the other medications can be stopped within a month, but the blood thinners like aspirin or clopidogrel has to continue for a year, and then that can also be taken off, because the stent will be get covered with usually maybe get covered within 6 months or so, but usually most probably by 3 months, but we don't want to take the risk. So at least one medicine to be continued till 1 year, blood thinner. So that is the importance for any liver patients. If you get the fatty liver patient, fatty liver only, usually by the end of 3 months, the fatty liver will be gone. If the fatty liver grade 2 is there, most probably it will come down at least to grade 1. And by 180 days, it will be, if the patient is following. Everything is dependent on how much the patient is adhering to the supported lifestyle correction. And those who are severe disease, usually what we give is up to till 90 days full support, then gradually reduce. And most of the patients by 180 days, body will be corrected. But if the patient is very obese, or if the patient is slightly not following everything in the best possible way, then it may take some more time. And also for the cancer patients and autoimmune disease patients, more intense follow-up may be needed for some more time, or maybe at least once in a year checkup. And for everyone is they have a tendency for the sickness, no? So the need to follow-up, especially the cancer patients and the autoimmune patients, and everyone should have at least yearly checkup. And if there is anything is gone wrong, get corrected. That is the thing. Next, we should see if he is not joining for this clinically supported lifestyle correction, what is his option? His only option is continue the medication, diabetes medicine and hypertension medicine, and checking every 3 months or 6 months. Usually in such patients, they'll ask for, if it is in the gastrointestinal specialist, they'll ask for every month or every 3 months check for it. The liver function and all. If it is the liver function is going down, the patient is getting edema, or the site is tap, or some way to reduce edema, additional again more medicine. And finally, what we can offer with the modern medicine, what we can offer is a liver transplant only. So we liver transplant it a 71-year-old man. We know what are the complications. It's not worth going for liver transplant and taking the risk, because liver transplant, if you are live donor, the wife, usually wife will be the donor, or the children, so they are even much younger. So it's liver donation is a very risky for the donor also, and the recipient also. Definitely, the recipient also, it is a very risky procedure. So if the kidney donation, 2 kidneys there, 1 we can donate, and it is not a major surgical procedure. And in the kidney accepting also, transplanting the donor and the recipient, the patient also, is not that risky, because the original kidney is not removed. and you are actually implanting the kidney in the pelvis. In a special kidney, you will be having 3 kidney. That's all. So the surgical part is very simple. Only thing you have to take the immunosuppressants for lifelong. That we should be very careful. That is the thing. When we come to the liver transplant, see, for transplanting the donor, almost 60 to 70% of the liver is removed. So it is a risk for the donor. So usually the live donor means it should be very close to the family. Otherwise, you can my children or a wife. So it is really not advisable for this age. Then even if for the recipient also, the patient also, unlike the renal transplant, here the liver has to be removed. The diseased liver has to be removed and replaced with a new one. So it is much more complicated procedure, and also the success rate also can be much less compared to a kidney thing. And when if it is a cadaveric or this brain death patient also, we should understand that the patient is the heart. When the heart is beating, the patient is not at death. You are removing all these organs under anesthesia. Even for this brain death patient, the removal procedure is done under anesthesia because it can be painful. It will be even the brain death patient is not conscious. It is a problem. So when we donate also for your dear ones, when it is brain death, you should understand these things also. When the life is there, pain is there, you are removing an organ. So that also, when you are accepting also, you should think. You should not be at this age and all. So we should accepting and donating. Even you are giving a consent for your for organ transplant, organ donation after death. You should consider all this point, and the ethical and other consideration, and also if you are giving a permission for transplantation, whether it can be misused also. So, or you should accepting or donating about the liver. You should always understand everything and then only do such things. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.